Have you ever experienced numbness in your arms or legs, or a nagging pain in your back that won't seem to go away? If so, your doctor might recommend a lumbar myelogram, which can help uncover some of the reasons behind the pain. A myelogram is an imaging procedure that examines the relationship between your vertebrae and disc through your spinal cord, nerves, and nerve roots. According to the National Library of Medicine, an American neurosurgeon, Walter Dandy, first proposed the intrathecal injection of a substance opaque to X-rays as an aid to the localization of spinal cord lesions. This type of procedure determines whether there is anything pressing against your spinal cord, nerves, or nerve roots causing pain in your back or numbness and weakness in your limbs. A radiologist typically performs this type of procedure. Before the test, the radiologist will inject a contrast medium, also called a dye, into the spinal canal through your lower back. The dye consists of iodine, a non-metallic element used in contrast agents that makes vessels and tissues show up on diagnostic imaging. The CT scan of the spine will be taken to get more detailed images due to the dye. The dye blends together with the spinal fluid, giving the neurologist a clear look at the bones and soft tissue that could be causing the discomfort. A myelogram test can be performed along with other spinal examinations, such as magnetic resonance imaging, MRI, CT scans, and regular spinal X-rays. If any of these tests don't fully explain what's causing the symptoms, or if the doctor needs more information about the bones in the patient's spine before making any decisions about treatment, they might suggest a myelogram and post-myelogram CT scan. Doctors typically suggest this type of procedure after a recent surgery, especially if you've developed any new weakness or lingering pain after going under the knife. After a lumbar myelogram, there are a few different things that could be responsible for the patient's discomfort, such as herniated or bulging disc, arthritis in the spinal joints, tumors within or adjacent to your spine, or an infection. Because this procedure requires an injection of the dye, it has a few risks, including spinal fluid infection, meningitis, a spinal headache, bleeding around the spine, and allergic reaction to the contrast material. So if you experience any type of pain in your back that won't seem to go away, it's time to contact your doctor. It can be very dangerous to experience numbness or weakness in your arms and legs, especially for driving or operating any kind of equipment.